minutes each, and also for the Minister of State. Ronnie Cowan.
Thank you very much, Mr Pritchard, and I congratulate the Honourable Member for Keighley for bringing forward this debate here today. I understand the frustration I've heard today. My constituency of Inverclyde is one that was deprived in the United Kingdom, and we have a lot of drug use and drug abuse and drug criminality. So I see it, I hear it, understand it. People come to my constituencies and they tell me the same stories. But I'm coming at this from a different angle. We all despise the drug gangs and what they do in our community. And we despise the fact they drag young children into their criminal world and they are abused and used in that society, that part of society. We all get that. If we've got 100 criminals each committing one crime in our constituency every day and we arrest those 100 criminals, the problem doesn't go away. It simply doesn't. Don't take my word for it. Neil Woods, undercover cop, wrote the book Good Cop, Bad War. Neil was at the forefront of the battle on drugs. He was an undercover policeman. He worked closely with drug gangs, put his life at risk, was responsible for the locking up and the incarceration of one of the biggest drug gangs in the United Kingdom. All gang members, from top to bottom, all their drugs, all their weapons, huge amounts of publicity for it. And Neil says, within hours, the drugs were back in the streets and the criminals were back out there. Within hours. Because when you take away one gang, you create a void, you create a vacuum, and other gangs will fight over it, and the criminality escalates because that's how they take control. So that's not working for us. And the problem I find is that we've been doing this for 50 years, and it simply doesn't work. And I don't see any real change in attitudes from the government that says, let's try something different here. As I mentioned earlier on by the Honourable Member, we cannot arrest our way out of a drug crisis. You ask virtually every single police officer in the United Kingdom and they will tell you the same thing, and they're living with this day in, day out. We need to address the problem and not the symptoms of the problem. This is a very complicated problem, and overly simplistic solutions just will not cut it. Why do people self-harm with drugs, and what can we do to help them? Why and how do we take the power away from the criminal gangs that drag people into their world? The UK Government's new 10-year drug strategy brings much needed money to rebuild drug treatment, but lacks real reform. Despite repeated calls from experts to adopt a new approach, the plan does not mention drug consumption rooms or overdose prevention centres, I'll call OPCs from now on, or heroin-assisted treatment. And the only reference to decriminalisation of drug possession is an unfounded statement that it would lead to increased drug use. OPCs are hygienic, safe spaces where people can use their own drugs under supervision of trained staff and where overdoses can be reversed with naloxone. They are vital for engaging with people who are not in contact with local treatment services. A large percentage of those who are dying from drug-related deaths have not been in contact with treatment services for the last 5 years. This is in addition to the shockingly high rate of drug-related deaths amongst the homeless population, which have more than doubled since 2013. It is estimated there are nearly 200 OPCs in operation across the world in 14 countries, but not in the UK, as this government continues to believe that OPCs condone the use of drugs, and they prefer to continue to ostracise and marginalise drug users and then wonder why the crime rate is increasing. There's a wealth of evidence for the effectiveness of OPCs to engage with people who inject or smoke drugs. OPCs not only reduce risk of overdose and bloodborne virus amongst the young people who use their drugs, they also reduce public injecting and drug-related litter. These facilities can also provide pathways to treatment and healthcare facilities. The strategy also fails to address the harms of current drug policy and drug law enforcement, including that police stop and search as racially disparate. Drug laws are imposed most harshly against ethnic minority communities, despite prevalence rates among these groups being no higher than among the white population. There are two things we need to do. First and foremost is to treat addiction as an illness. We must bear in mind that just like alcohol, which is a dangerous drug, about 90% of those who use illegal drugs do not have a problem and certainly do not turn to crime. We must provide the right sort of health care, care based on the needs of the person suffering from an addiction. And I say this because in recognising drug use as a health issue, it's clear that increasing access to treatment, harm reduction and social services will lead to better outcomes than criminal justice sanctions. Even with those who receive non-custodial sentences, including formal cautions, gaining or adding to a criminal record can cause serious damage to life chances. Brett Jensen and colleagues outline that criminal records, especially when containing drug-related offences, present obstacles to obtaining employment, seeking rented accommodation, education attainment, international travel and maintaining interpersonal relationships. If we don't provide the right kind of support, then we're stuck in a downward spiral of addiction, crime and prison. Most people will publicly agree with that, but when it comes to how we deal with criminality, the debate takes on a whole new dimension. The criminality comes from two sources: people with an addiction who turn to crime to fund their addiction, and the criminal fraternity who leech off those with addiction and supply the marketplace. First, we need to identify what is criminal behaviour. Increasingly, personal possession is not being seen as something that people will be prosecuted for, and I welcome that. The decriminalisation of all drug possession is backed by all 31 United Nations agencies and acknowledged by the World Health Organization as a critical enabler of service access. Previous committees on this place have also advocated for a move away from criminalisation, including the UK Parliament Health and Social Care Committee and the Scottish Affairs Committee. The National Centre of Expertise on Drugs and Drug Law, Release, has explored decriminalisation in over 30 jurisdictions and has found that drug decriminalisation, when done well, can improve health outcomes, reduce drug-related deaths and reduce offending and reoffending, and therefore reduce the burden on police resources and public spending related to social costs, which is essentially the targets of the new 10-year drug strategy. This is in addition to evidence that policy liberalisation is not associated with large increases in drug consumption in countries that have reformed their laws. Drug laws and drug law enforcement are used as mechanisms to punish drug use, with the threat of punishment considered a tool of deterrence. The Black Review estimates the spend on UK drug law enforcement to exceed £1.4 billion per annum. Yet the Home Office's own 2014 analysis of drug policies in 14 countries found that there is no apparent correlation between the toughness of a country's approach and the prevalence of adult drug use. Another 2017 Home Office evaluation acknowledged the resilience of the illicit drug market and limited impact of drug law enforcement, including significant drug seizures and the availability of drugs. It also identified unintended consequences associated with drug interdiction, including increased violence in the marketplace resulting from enforcement activities, criminalisation negatively impacting on employment prospects, and parental imprisonment, which can have dire consequences for children, increasing the risk of child offending, experience of mental health problems, and problematic drug use. A linchpin of the new 10-year drug strategy, county lines, is being framed as an altogether new phenomenon that facilitates the supply of mostly heroin and crack cocaine into non-metropolitan areas, even though heroin and crack markets in these areas already existed. Those that have studied county lines have shown that the entry of drugs into rural areas, sometimes via the involvement of young people, is no new feature of an unregulated drug market. It is also the case that some young people choose to engage in the market because of a lifetime's choices, because of a lack of life choices and opportunities. Therefore, focusing on social and economic policies rather than drug law enforcement would reduce involvement. We got it wrong 50 years ago in the 1971 Misuse of Drugs Act, and we've been getting it wrong ever since. If you want to reduce crime, then decriminalise drugs to take the power away from the criminal gangs and make consumption safer while treating addiction as a health issue.